starts with the healthiest people on earth. Mr. President, back to you.
Thank you, Joe. Great job. Beautiful. Thank you. Well, thank you very much. Really amazing the job you've done, and so quickly. Now I'd like to ask Secretary Kennedy to say a few words, and Dr. Oz and Mark Cuban and Chris Klump, and we'll take a couple of questions maybe at the end. Thank you. Bobby, please.
Thank you, Mr. President. The epidemic of chronic disease in this country is now existential. If you include my agency plus Social Security and the VA, Americans now spend 48 cents out of every dollar that we spend in federal taxes now go to health care. 90% of that is for chronic disease. And those costs are increasing at 2% at greater speed than the GDP. In addition to that, it poses an existential threat to our national security. 77% of American kids cannot qualify for military service. President Trump has pledged to end the chronic disease epidemic, but in the meantime, many people need medications to treat their chronic disease. And President Trump has asked us to make our country, the most affordable medication in the world, and he succeeded in doing that. And I want to say one last thing. President Bush promised to do this. President Clinton promised to do it. President Biden promised to do it. President Obama promised to do it. President Trump actually got it done. And it's an extraordinary accomplishment. It's an extraordinary legacy for him, and it's a gift to the American people. And I want to thank you again for your vision and for your determination.
This is yet another example of this administration, of the president's leadership, making life more affordable. And it's in a particularly important arena because almost 1 in 3 Americans, when they go to a drugstore, cannot afford to pick up the medications that their doctor prescribed for them. And part of the reason for that, which the president recognized early on and pushed hard until it got done, because it was a force of his personality that allowed us to go to all the major pharmaceutical companies representing the vast majority of the marketplace of branded drugs in America. But what he realized was we're paying 3 times more for the exact same drugs made in the same facilities, often in this country, than people overseas are paying for those exact same drugs. Whether it's weight loss drugs, fertility drugs, you name it, we're overpaying for it. President wanted that stopped. He wanted it to stop now. And so he did it. The most favored nation drug pricing approach works using a variety of techniques that he outlined, but we needed to make sure you had an ability to access these drugs. TrumpRx.gov is a phenomenon. Over 10 million people have visited the site. It is the fastest site of its kind I've ever seen. As a physician who's used to looking at medications and having no idea what the patient will pay, it's as transparent as you just saw, built by the fantastic team with Joe Gebbia. They started with dozens of medications, Mr. President, which is the number of medications that had been negotiated by Chris Klump and the team at HHS. Today, 601 more medications were added. 601 more. As the president said, 7 times more drugs are now on this list, which means something really important. You should not buy a drug in America without first checking the best transparency site ever created for medications to make sure you're not being taken advantage of. You wouldn't go grocery shopping without knowing prices. You wouldn't buy a car without knowing prices, lease an apartment or anything else. You shouldn't do it with the medications that could save your life. We believe that more than half of all the prescription interactions in America are now going to be revealed on TrumpRx. If you wish to use the site in any capacity, this is the time to start. It's a technological feat. It's created transparency with no middlemen. Just what the president promised. And for that reason, we ask you today to go look at the site, TrumpRx.gov. Ask us to put you on our mailing list. So when the team at the National Design Studio wants to contact you about new medications that are being offered, new ways for you to save money, new ways for you to make health more affordable, so your zip code doesn't determine your health, you'll have TrumpRx.gov to go to. Mark Cuban has been an outspoken advocate for more transparency in medications. He built a business around it, and he's one of the companies that's joining us now to put their products on TrumpRx.gov. Mark?
Thank you for having me, Mr. President. I think other than you, I've been the biggest proponent of TrumpRx.com. And the reason for that is Republicans want cheaper drugs, independents want cheaper drugs, Democrats want cheaper drugs, and together, I think we're going to do something special. What makes Cost Plus Drugs different is that when you click through TrumpRx to our site, not only will you see a great price, but you'll see our actual cost and that we only mark it up 15%. And what makes this incredible, Mr. President, all the volume and all the people that are going to come from the site, as our volumes go up, our costs go down, which means we'll be ending up charging less to people over a period of time. So this is a special announcement. This is a special partnership. 559 of those drugs are ours, so we're really excited to be part of this. Thank you so much for having me. And I'll turn it over to Chris Klump. Thank you. Thank you.
So you've just heard about the addition of generic medications on TrumpRx, which is fantastic. TrumpRx is now the true single source of truth for the lowest prices for American families on their prescription medications. But what matters even more is what comes next. So we are on an irreversible trajectory. An American family right now taking a GLP-1 will save this year, right now, about $1,800 less than they would have 4 months ago before the advent of TrumpRx.gov. An American family trying to conceive and needing fertility medications will save nearly $6,000 per live birth right now, thanks to TrumpRx.gov. That's nearly $5 billion going to the pockets of hopeful parents over the next decade. So how do we achieve this? By proving that in America, you can do well by doing good. TrumpRx has created a revolutionary vehicle for a true public-private partnership. Private innovators are stepping up to the plate, and they're doing it not just because it's the right business decision, but it's the right moral decision. So to accelerate this process, we will continue focusing on 3 things, the same 3 things we talked about you in our last conversation on most favored nation pricing led by the president. First, we continue to bring additional industry partners on board. Last time we had a conversation with you about MFN, we put out a call to small and mid-sized biotechnology manufacturers and pharmaceutical companies to come sit with us to make their product portfolios available at MFN prices. We said that we would be fair and we would be reasonable, and the industry has answered that call. We've been inundated with demand for discussions to ensure that every American family can continue to access MFN prices, not just for the companies that have been negotiated, but for the many that are yet to come. Number 2, as the president mentioned, we are continuing to negotiate international trade agreements. Those are well underway, working lockstep with our partners at Trade and at Commerce. And number 3, legislation. We are continuing discussions on the Hill with Congress to ensure that the president's great health care plan lasts for decades to come, guaranteeing greater affordability, greater accountability, greater transparency for every American family. It turns out, as Mark said, there is appetite on both sides of the aisle to make progress on this important point. When a parent goes to the pharmacy, they're not thinking about political ideology. They're thinking about what's best for their family. And today, leaders across the spectrum, irrespective of their party, are standing together because Americans demand affordable health care, and it's an American imperative. This president has set us on a course to permanently benefit from lower drug prices as a country. The foundation is built, the market is engaged, the future is affordable, and I yield the podium back to the man who made all this possible. Thank you, Mr. President.
Would you like to say something? You're over there, you look so beautiful and nice. You two, come on over here. Just say a couple of words about.
Thank you. Thank you, Mr. President, for having Amazon here today. It's really great to work with the administration and the NDS on building TrumpRx at Amazon Pharmacy. It's been our mission to build a pharmacy with price transparency from day one. And it's been our mission to make sure that Americans who need their medications know how much they're going to pay out of pocket for brand or generic medications. It's what we're built around, whether you're paying cash or insurance. And we look forward to continuing to innovate on this.
Thank you very
Thank
much. Thank you. Good luck with it.
I'm going to move this up just slightly. Thank you for having us on behalf of GoodRx. Look, we have shared mission as everyone up here to deliver healthcare that's affordable to every American. We couldn't be prouder by what you're doing and be part of it. So thank you so much.
Great job. Well, thank you very much. Any questions of these brilliant people? Yeah, please, go ahead. Go ahead. Yes. The white? Yes.
At the mosque in San Diego. On the IRS,
They're giving a briefing on it a little while at the mosque. They're giving a briefing, and it's a terrible situation. I've been given some early updates, but we're going to be going back and looking at it very strongly. Yeah, please.
Justice Fund created $1.6 $1.7 billion
Can you speak
that
a
the
little bit about
IRS
your
is now
pulse on
going
Wait,
Truth
excuse
Social?
me?
Can you speak a little bit about your pulse on Truth Social on Iran, and what was the decision that why you didn't attack Iran?
Well,
You're
other
not
countries have come to me and they've said we were getting ready to do a very major attack tomorrow. I've put it off for a little while.